the Swedish National Road and Transport Research Institute in Sweden. And I will talk about a study that we have done in Swedish urban areas. And I haven't done this study by myself, but with my colleagues Malin Henriksson, Kristina Lindqvist, and Karen Lucas. And the background of the study is international research on transport-related social exclusion, which points out that lack of or inappropriate public policies and service planning increase the risk of being excluded from important societal functions, such as work, education, and leisure activities. Previous research in Sweden shows that people in socially deprived neighborhoods travel less and own a car to a lesser extent than people who live in neighborhoods that are not deprived. A neighborhood that is defined as socially deprived suffers from low socioeconomic status, criminal impact, unemployment, ill health, and problems with schooling. And again, the international literature shows that poor access to transport options in combination with disadvantaged social circumstances such as unemployment, housing shortage, and ill health increases the risk of being socially excluded. So we asked ourselves when we planned this project if the international literature on transport-related social exclusion is applicable to Swedish conditions. And do people in, sorry, I should switch here. Now, we asked ourselves if people in socially deprived neighborhoods in Swedish cities experience transport poverty. And how is the risk of being transport poor expressed in Swedish conditions? And what does public transport mean for social inclusion and exclusion of socioeconomically weak groups? We chose to study two areas. Angered outside Gothenburg, which has 52,000 inhabitants approximately, and northern Botkyrka in Stockholm, which has 40,000 inhabitants approximately. These are all defined by the police as especially vulnerable areas. And the areas have several risk factors for social exclusion. And many of those who live there, they are also at risk of becoming socially excluded due to ethnicity and low income. In this study, we have been interviewing 41 individuals, either individually or in focus groups. They were 16 to 72 years old, and one group, so to speak, were young and unemployed or students. But we also interviewed people who work as assistant nurses in an elderly care home. And this home was peripherally located in a suburb outside of Stockholm. But why is it interesting to study Swedish urban areas? Well, our discussions were that one concern we had when we started this project was the fact that Swedish suburbs, especially within the three large cities of Stockholm, Gothenburg, and Malmö, are relatively well served with public transport. So we were resistant to whether transport access was an issue for people who live there. The study areas belong to what is called the Millennium Program areas, which was built during the 1960s and 70s, with the aim to overcome housing shortages, reduce overcrowding, and raise the standard of living. These areas were planned to include public transport, green areas, recreational areas, and shops, services, and schools close to the homes. Typically, for these areas is that traffic and residential areas are separated to increase safety. But in some cases, it had consequences such as increased insecurity and crime. The housing environment here has come to be considered unattractive, which has contributed to those who could afford to move did so. And those who remain in the area were people with lower socioeconomic status. But also the million programs have been described as an asset, as an examples of existing areas that can live up to today's requirements of sustainable, densely populated areas with traffic separation, country yards, and green areas. So the fact that the people we interviewed live here is important for their experiences of the transport system. And the young participants that we talked to, they describe relatively good opportunities for mobility and accessibility. They say we can go anywhere we want. They have access to regular services in the areas in which they live, which was one aim with the million program areas. And most of them live just 5 to 10 minutes walk from a station or a bus stop. And they are also financially supported by parents, even though they are not rich in any sense, or they also can also be financially supported by schools or social services if they participate in a labor market action program. They also have few space-time restrictions, which is typical for people in their age. I mean, they don't work that much, they don't have small children, they do not have to travel during rush hours. They have quite a lot of free time because many of them are unemployed, and they therefore do not need to travel at certain times of the day or keep specific appointments. So lack of interconnections and delays in public transport do not affect them as much as those who have to get to work. And these are all important reasons why they do not experience mobility restrictions. The young participants also describe that tickets and monthly cards are very expensive for them and for their friends. And they have worked out some strategies not to pay. Either they can walk a little further to pay a little less on the bus or on the tram, or they are forced to stay at home. And they also have strategies for not paying, so-called free rides. Another result was found in the interviews with the assistant nurses at the elderly care home. Their job situation determines their transport options. First of all, they have a physically straining work because they work with older ill people. And to walk to the commuter train station, in this case, which was 3 kilometers away from their work, becomes an additional physical strain for them. And they also work early mornings, late evenings, and weekends when public transport access is not that good. But colleagues and the elderly, they are dependent that they are on time for work. Low paid work, short education, and language difficulties means that they have a limited labor market. So it's not that easy for them to find another job closer to home. And most of them that we interviewed here, they are women with a foreign background and low education. It is a social group where driving license holdings are low in comparison with Swedes in general. So they are dependent on public transport to get to work on time. So a few conclusions from this study is that to live in a socially disadvantaged area does not seem to involve any unique experiences or strategies for mobility based on our studies. And this is in comparison with other studies and also in comparison to studies with people in rural areas. But low income, low education, and lacking language skills become restrictions to get a driver's license, to afford a car, or to move closer to work and school. So public transport for them is vital to be able to participate and integrate in society. So people's total potential time space prism, so to speak, where can they go and how much time will that take, determines their access to work and important societal functions, not only whether there is good public transport in the residential area, it also, as I say, depends on where they have to go and where they work and how much time it will take for them to get there. So we have seen in this study that many other political areas but transport policy are important determinants of transport-related social exclusion. We therefore want to highlight how important it is to coordinate public transport planning with other political areas, such as labor market, public health, urban and infrastructure planning. So thank you very much for listening.
Thank you very much, Jessica. I think that was really interesting.
Should I stop sharing my screen?
Yes, let's do that. And let's see, we can see everyone again. So, sorry. Yeah. So, do we have any spontaneous questions? Were there any findings that surprised you in this study, Jessica?
Well, actually, because of the international literature that shows examples of transport poverty and transport-related social exclusion, we actually expected to find more of struggles for getting to school, to work, to be able to participate. But we didn't really, and actually first we planned to make a study among young people and unemployed people. But later on during the study process, we also got in contact with people who worked in elderly care and in this home which is located outside of the urban area. And then we started to plan to study these people who worked in elderly care and other kinds of women with low education, women with low income, and then we just started to find that these people are at risk of becoming transport poor. So we would like to go further in another research project later on to study this a little bit more and also combine these studies with looking at alternatives to public transport, such as new mobility services and so on.
Interesting, because that specific group is also one of the most vulnerable groups in society in general.
Yeah.
So it's quite sad in that sense. Does anyone else come up with a question?
Yes, if I may.
Yes, please.
So my name is Alda Nicodemus and I'm representing WASAP, which is cooperation among spatial planning and development ministries around the Baltic Sea region. So I have a question to Jessica. do you have studies about attitude and something else about autonomous driving? You mentioned that there are these driving licenses are not so many for people, many in those special these areas. So do you have some investigations and already examples? I know that Sweden is quite advanced in this, at least theoretically, regarding autonomous driving. It means also for public transport, not only for cars.
Yeah, we have a lot of companies in Sweden that are developing these kind of techniques, and we are testing infrastructures for autonomous driving parts to drive autonomous in different parts. But I have to say that typically people who answer questions about attitudes towards autonomous driving and if they would be able to, or if they are interested to use this kind of technique, are seldom the persons that we have interviewed. It's usually people who are well off, who are these typical people who try new techniques, innovators, also often highly educated, often men, white men, who have flexible working hours. So, and I personally, I'm not sure if asking questions about attitudes towards something that doesn't really exist in reality is very fruitful, because people can answer, well, yeah, that sounds good, but then how should it fit into your life balance, the puzzle of everyday life, and so on. So it's difficult to ask question what they think and draw conclusions on what they would actually do if it would exist.
Thank you very much for your answer.
Thank you.
Thank you. Anyone else? And we have some people working with other solutions. Have you seen similar patterns in your regions? I know we have both our Polish partner here and Finnish and Danish.
I can say for Denmark, it's quite the same, but then again, Sweden and Denmark are very similar. So what Jessica told here is it's basically the same in Denmark. Yeah. Mm-hmm. I'm just interested in knowing, maybe, do you find that the transport companies or the public authorities, do they use this kind of surveys, or do you find that they just kind of say, okay, we already know, blah blah, kind of ditch you off?
No, I believe that the interest for social sustainability is becoming more and more common, but that the regional transport authorities are actually asking for knowledge and asking for how can we work not only to implement transport that is ecologically sustainable, but also socially sustainable. But overall, the knowledge about and to think about other social groups than the group that you belong to yourself is still, it's still lacking. Actually, it's easy for planners to think about how should I do this, and planners and researchers usually belong to these groups who are quite well off and equal, and so to speak. But there's so much more to explore when it comes to socio-economy in transport planning. And I would like to know how it is in your countries when it comes to think about socioeconomic differences in transport research and planning. Is it something that you talk about, or is it it's an issue, I understand, but is it something that is on the agenda, so to speak?
Also, would you like to say something?
Can I just before that just say, I mean, from a Swedish perspective, and hello, by the way, I'm Åsa Hildestrand. I'm working with Johanna at Norregio, and I'm just going to be part of specifically the third part of the seminar series when we start talking about the policy issues and the legal frameworks that could be challenging when we want to develop these new solutions. But anyway, just today, I kind of, I just wanted to say that I don't quite agree. I missed the starting point of this, so it's maybe I'm really saying things that you already commented on. But I think in Sweden, I mean, the whole idea of having an extensive public transport network is a way to work with social inclusion, and that's what we've done since this started to develop early on. So I mean, we know that the richest ones, they have their own cars, they still drive a lot. They're not the main users of our public transport system already. So I don't think, I mean, now when you talk about it, you make it sound like we're leaving people behind, but specifically in the urban areas, I don't think that's the case. And we know that it's, that access to suburbs is very dependent on public transport. And that's why we have commuter trains, and we have underground, and we have buses, we have everything, and they're heavily used by the low income segment of society. So I was just wondering what you meant by that. But are you talking about the niche thing about specifically driverless buses or things like that? Maybe that's a different category, but I don't think we should say in general that it's difficult for poor people to get anywhere. I mean, in a global context, we have fantastic accessibility through the public transport system in Sweden.
Yeah, we do, and that's what we found among the young people who live, for example, in Botkyrka and Angered, and also in other cities in Sweden. The public transport is quite good. But when we talk about who, it's still the discussion about who is using the system, and also who are the users or the expected users of new mobility services. The discussion tends to talk about people overall, and not really going further into which are the users and what kind of where are they from, what language do they speak, what kind of income do they have, do they have certain skills or do they lack certain skills. That discussion, I believe, needs to become even more.
But then you're talking about new solutions like ride sharing, for example.
For example, but also, as we could see among these women, they live in areas that have very good public transport. Botkyrka, for example. The public transport there is probably the best in Sweden, but they don't travel within Botkyrka because of their low education. They need to take jobs somewhere else. And then if we take these women, for example, they work in an elderly care home that is very far from the urban area, and they need to get there. And when they built this area, and when they built this nursing home or elderly care home, they didn't really think about, well, who's going to work here? And these people who work in elderly care homes, they are not the typical, high incomer or car driver and so on. So that's what I mean. I mean, we have to think about not only look at the supply of public transport where people live, but also where do they work and where do they have to go. and what are their options.
Mm. But then there is also another, because I just came back living in Jordan, Middle East, for 3 years, and they have huge challenges with getting any public transport anywhere and to schedule it and all that. So it was a totally different situation, and it's very interesting to see how complex and complicated it can be to establish public transport at all. But then another big issue is the cultural issue that many women are not allowed to take the bus, and it's not considered safe, but depends how you define safe. And we have a big issue with overprotection of women and things like that. So I would say it's also probably the case in Botkyrka with many women from the Middle East, for example, that they might be, they might either think they'll be harassed on the bus because there are rumors that you are, but you're not. But, you still nurture these stories because you want to control women and you want to, is it really necessary to take the bus? That's what...
Absolutely. And some comments that we got earlier in discussions about this study was that, well, can't they just take the bike between the commuter train and the work? Well, yeah, it's easy for someone to say that are able to bike and can afford a bike and know how to bike, but also many of these women, they can't bike, and they also have clothing that prevents them from biking. So that's what I mean with not only looking at yourself as a researcher or a planner, but to take other people's perspectives and experiences.
Yeah. No, I mean, it's definitely true, and we have to understand that that's a big difference in lifestyle that we face with all these new cultures that are in our countries that weren't here before. So it's definitely other aspects. But I'm also thinking that specifically elderly care homes can sometimes be placed in super remote areas because that's where it's cheap to build them. And of course, that's a planning issue that's totally overlooked when you don't have access to these places. But that's, I think, is also a slightly different issue where you really need to make sure, also from the perspective of the ones who live there, they can't get anywhere, like they're isolated where they are.
But again, as Jessica is saying, it's easy to get stuck in because I also live in urban Stockholm. I live very close to the center, so I have many options of traveling, but you just need to go 15 kilometers out of the center to areas that are still considered to be part of Stockholm, and there is like 2 buses a day even, or 1 every second hour in the evening. And if you then work in an urban area, like even in the city center, traveling home in the evening from work might be a big issue. And then you come back to what you were talking about in your presentation, that maybe you live in an area that is well connected, or you work in an area that's well connected, but then actually getting there in early mornings or late evenings when your shift's ending might be a big hassle. So But we are running really late, which is okay because this has been very interesting. So I would just like to ask, has anyone else have another question?
Can I, as usual, as the last, I have a word. I was just thinking how our target group for our application and our research, how it matches the new reality. And well, as usual, young people are very entrepreneurial and they find their solutions. They want to be independent, so we can see an actual boom for especially electric scooters, not bikes, but scooters. The cars are not very popular because we recently had several shared cars. The company tried to introduce them into the market in our city. But I was struck just yesterday evening or afternoon by a fantastic view. An elderly lady in a big helmet going on the electric scooter. She passed me like the wind, like whee, and off she went. And I practically envied her. And I thought, yeah, that's what I want to be in the future. I have one problem though. What about the dog? I think that in all the research or innovations and all activities, all our attempts to make the mobility better, we might try to also look at the niches. Because when we talk about people who cannot travel, who are disadvantaged in the aspects of transport, we address them to the bigger, more homogeneous groups. But then with all the digitalization and all the AI introduced, we might actually try to address me with my dog in the future. Okay, and the husband, all right. Very specific needs of individual persons who are in the different, slightly different situation, to give them more independence, because we are looking at an elderly now, we are looking at young people, we are wondering where they are going to be in 5 years, and all of a sudden we can face the fact that we forgot about ourselves. Our generation, which is fully working, fully active, and it's just a thought after the first session of today, and after looking at the result of at Jessica's presentation, and I was just seeing these young people sitting in the public transport with the noses in mobiles as usual, of course, and it struck me, okay, we address the same groups, but what about ourselves and the dog? Thank you.
Is that a question?
Alexander.
Rather say it's sharing a thought, I suppose.
Well, thank you for sharing that.
Yeah.
Yes.
Well, my comment is just that we need to know how people, the people's needs and I mean, other different types of people, different ages, gender, socioeconomy, and stuff. We shouldn't forget anyone, actually, when we plan.
All right. Thank you all so much. I think we will end this session here. I really hope to see you next Thursday. I know that we had some technical challenges today. We're still learning, so we hope to overcome that. Yes, thank you all so much. And we will share the presentations, and you can also find more information on the MAMBA website. And I hope that you all know where to find or where that website is. Otherwise, I'll just share it here in the chat with you. You should have also seen it in the emails you received from us. There you go. So unless there are any more questions, thank you and see you next Thursday.
Thank you.
Thank you.
Thank you. Bye.
Bye.